including an endoscopy, which will allow her to get a detailed look at his large intestine.
We were real hopeful that, this is it. These tests are going to come back and they're going to tell us what is wrong and we're going to know what the answer is.
But 2 weeks later, when the test results come in, they're nothing short of shocking. Everything appears to be normal. Completely baffled, the doctor tells the Burchiellis that the only thing they can do now is wait and see what happens next. And sure enough, a week later, the crippling constipation sets in again.
Before it was more gradual. This time it was like within a week. We were huge, rock hard belly. He was in a lot of pain. He was crying. He wasn't eating.
Tyler sometimes reminded me of a third world malnourished child with a big distended abdomen and the skinny little arms and legs.
He was just even more sick than we had ever seen him in his life.
I think that Tyler couldn't understand why we as his family, the adults in his life, couldn't fix him, make him feel better. So that makes you feel like you're failing your child. I can't imagine how difficult that was for Janelle.
Beside herself, Janelle takes Tyler back to the pediatric gastroenterologist. As soon as she hears how quickly Tyler is deteriorating, she performs a water-soluble contrast enema test. A radiopaque dye is introduced into Tyler's colon, enabling her to take an X-ray of his large intestine. An hour later, the Burchiellis head home to wait for the results. But almost as soon as they walk in the door, Tyler takes a turn for the worse.
Tyler just started throwing up. And he just kept throwing up, and he just wouldn't stop.
Janelle immediately picks up the phone and makes a frantic call to the doctor.
She said, he needs to go to the emergency room, and you need to go right now.
4-year-old Tyler Burchielli hasn't had a bowel movement in the last month. And when his doctor administers a highly specialized enema in an attempt to find out why, the fragile young boy starts to vomit uncontrollably. Now his parents are rushing him to the emergency room.
We had a little bucket for him to throw up in. Andy drove to the hospital. I sat in the back seat with Tyler and helped him.
I think Andy and Janelle thought he might not make it home again. They were very, very frightened.
After giving Tyler a medication to control the violent vomiting, the ER doctors turn their attention to the real problem, his blocked colon. They call in pediatric surgeon Dr. Robert Gates to take over the case.
You look at these children and they are obviously helpless. They are in extreme discomfort. Tyler was breathing rapidly simply because his abdomen was so distended.
First, he orders a series of x-rays to find out exactly what he's dealing with. And as soon as he sees the images, it's clear that the little boy's intestines are severely impacted.
We proceeded to irrigate his colon in the emergency department. I was able to remove about 1.5 gallons of material from his colon. This is quite a bit of fluid to be retained in the colon of anybody, let alone a 4-year-old child.
After the irrigation flush, you could really tell his stomach went down. Like, it was the flattest we've seen it since he was born, basically. It was really amazing to see.
I told his parents that I was suspecting a number of different possibilities, but that he needed to be admitted to the hospital until I was 100% sure of this diagnosis.
Tyler was very stressed. He knew we were going to do something, but he wasn't sure what we were going to do.
As soon as Tyler is admitted, Dr. Gates walks the family through the next step in his investigation. He needs to perform a rectal biopsy, a surgical procedure that will take about an hour.
We irrigate the rectum and then take small samples of the rectal mucosa, and by analyzing that, we can determine whether or not there are abnormalities.
I'm kind of scared for him to have to go through a surgery. And we were very hopeful that we're going to find an answer to what was going on.
Everyone is anxious to know what the biopsy will reveal. And when the findings are in, Dr. Gates knows right away that he's found the critical clue he's been looking for.
The results showed that the child did not have ganglion cells in the wall of the rectum, which is diagnostic of Hirschsprung's disease.
Hirschsprung's disease occurs when nerve cells in the large intestine, called ganglion cells, don't form during fetal development. In a healthy individual, these nerve cells instruct the muscles in the colon to eliminate waste when it's full. But patients like Tyler don't have ganglion cells, so rather than passing through the colon, the stool simply stops moving, and over time begins to build up.
It would be like you have power lines running outside up and down the street, but you didn't connect the power line to your house, so the appliances are not going to work. And that's in essence what has happened with Tyler, is that he lacks the ability of the very end of his rectum to contract, and so everything else kind of backs up before that.
We were totally floored. None of us had ever heard of that disease before.
It was just a sigh of relief, actually, to know that they found an answer that we've been looking for the past 4 years.
But the news is bittersweet. Tyler will need to undergo an extensive round of invasive surgeries to help his colon function normally.
The way to treat Hirschsprung's is to surgically remove that segment of colon that does not function, the segment of colon that does not have the ganglion cells.
You're worried that your son's going to go through surgery. You know, it's like, wow, it's really hard to deal with everything all at once like that.
But left untreated, Tyler's life could be on the line.
The dangers of Hirschsprung's are malnutrition, perforation of the intestine, development of the enterocolitis, a severe overwhelming infection of the intestine that can result in death.
Assuming the surgery is successful, Tyler will also need to wear a colostomy bag for several months.
His colon was so dilated that we were going to have to resect a segment of that dilated colon and give him a colostomy.
The colostomy will connect Tyler's enlarged colon to a surgical opening in his abdominal wall. Until his colon heals, his stool will collect in a small bag on his side.
We were, kind of nervous and not sure if a colostomy was something we could care for, but, finally we had an answer and Tyler could go on and live a normal life after this.
On January 24th, 2008, they wheel Tyler to the operating room. Janelle struggles to keep a brave face on for her little boy.
In the elevator, Tyler asked a question. Are they going to cut me open with a knife? And at that point, my heart just stopped. I was just like, he understands. And I just didn't know what to say to him. All my emotions came and I just tried to hold it together for him.
You don't want to show any fear to your son to know that he's going to go through something like that.
All Janelle and Andy can do now is wait. Four hours later, after Dr. Gates has removed 25% of Tyler's lower intestine, he pronounces the surgery a success.
He said things went really well and, we could probably go home in a few more days after recovery.
Over the next few weeks, the Berchiellis couldn't be more relieved as they watched Tyler regain his strength. Still, they can't help but wonder why it took more than 4 years for someone to figure out what was plaguing their son.
A pediatrician will see so many different patients with so many different issues, and they look for common things. One analogy would be if you go to a horse farm, you expect to see horses. You don't expect to see zebras and giraffes. And that's what Hirschsprung's disease is, essentially, is a zebra in the middle of a horse farm.
Not every doctor knows everything, so you have to keep searching and just don't give up.
Making it even more difficult to diagnose was the fact that Tyler's case is less severe than many children with Hirschsprung's. It is most commonly diagnosed in newborns who are unable to pass any waste at all during the first days of their lives.
With Tyler, he was able to pass some stool. He still was able to grow and develop and did not exhibit the striking signs of Hirschsprung's that we'd see until the last several months.
Today, Tyler has regular bowel movements with the help of his colostomy bag.
He's definitely got used to having the colostomy on him. He doesn't want us touching it at all.